The ranking member.
Thank
You're
you.
recognized.
You know, I realize now, I have two grandchildren, and I'm starting to think like I'm talking to them. And there's a nursery rhyme, but I don't know, think they even know what I'm talking about. But I say it's called Humpty Dumpty. Humpty Dumpty sat on a wall. Humpty Dumpty had a great fall. All the king's men couldn't put Humpty together again. And this is what I'm thinking about right now when I'm thinking about foreign assistance. Because, first of all, thank you both. You're both terrific, and what you've done for humanity is amazing. What I'm worried about, I do like the concept that we can work together to let countries where they can have a sustainable health system, that they go on their way, that we get the private sector more involved. Very good ideas, I think. What I'm worried about, and I just want to know is, what has happened in these last 30 days or so? There was supposed to be a waiver, as I understand it, a waiver to allow, I thought, to let PEPFAR continue its work. And I know nobody likes to criticize this administration. Well, not nobody, me, I like to, but could you just tell me factually, what's happened on the ground in terms of, are these, are you talking to me?
No, I just say what's on and what's off.
Yeah, what's on and what's off? Because we've heard people haven't been paid, that some of the programs are shut down, that people were fired, they're not implementing. Can you just tell us where we are? Because, as I said, I'm worried that it's going to be so cracked up, sledgehammered up, that we're not going to be able to go forward like you're suggesting. Who wants to answer that? You both? Okay.
Happy to do so, Ranking Member. And I can speak to our experience with it. I do think this has been a challenging period of time. Most of us who work in the HIV community, and as we've talked about, every administration comes in with its own priorities and wants to review the program, and that was expected. I think the way that the review has been handled has been sort of challenging on the implementation side. It did start, obviously, with the stop work orders for all of foreign assistance, and that included PEPFAR at the time. And then there was this opportunity for the waivers to take hold, and many of our projects did receive life-saving waivers. There was a small, again, that did shrink the scope of work. There were certain activities that were not considered life-saving, like OVC and some preventive opportunities, but mostly treatment and care were considered life-saving. But those waivers were not implemented automatically. There was a process that had to go through once the waivers were announced. Then the implementing agencies had to apply those waivers to each individual project. So because you can imagine with all the PEPFAR projects, looking at each project, determining which part is life-saving, which part is not, revising work plans and revising budgets. And even then we still had to get permission to restart those programs. So we have been able to restart work in many places. But then what happened is that some terminations occurred. So even programs that did receive life-saving waivers were then terminated. We had 3 countries actually with terminated care and treatment programs. One was then unterminated. So again, as you can see, it's been very hard to sort of follow, like, what should we be doing? Even when we get permission to work, it's been hard to tell and work with the mission and with the national government. Are we ready to move forward? Can we move forward? Or is something else going to occur? So I think from our standpoint, I think one of the major things that we really want to see happen sooner than later is to really sit down and look at the capacity that's remaining. Is that once we get through this review period, what projects are standing, where can we continue work, and also all that work interconnects. I had a colleague tell me yesterday, she's like, the problem is by looking at all these projects individually, you miss the interconnectivity. So a project like ours, where we're working with pregnant women, we're able to get them tested, we're able to get them on ARVs, we help them through labor and delivery, but then the infant test happens, and that test has to be transported to a central lab to be processed. And that's where the transportation, the organization was doing that transportation is no longer there. And so that link in the chain, other parts of the chain are working, but once leak falls apart, it all starts to fall apart. And so I think until we get a sense of where that capacity is, where is the country able to fill gaps, where do we need to course correct after we look at what's happening in the field, I think we'll be able to move forward from there.
All right, well, that was very diplomatic of you. Thank you for your good work. My understanding is that the PEPFAR is not, as it was established, it was not just for emergency, it was also for prevention. So, I mean, because I think, and Mr. Dybel, maybe you would know this, there's something like 20 million people who are on medicine that keeps them alive and well. My understanding, that's been cut off. Is that that is the part of the program that's not in effect right now. Did I hear correctly? Either of you can answer the
I
question.
can answer that. You can join in as well, Ambassador. That was not considered, the work on prevention was not considered part of life-saving work.
All right, so in other words, you know, you are going to get an A for being diplomatic, but in other words, there are 20 million people plus out there who their medication has stopped. No, you say no, it hasn't. Go ahead. Mr. Dybel, you can speak.
I also have, the world is a strange place. I'm a PEPFAR implementer as well in Eswatini, and we are still delivering antiretroviral therapy, and the supply chain system that delivers it has been given a green light to begin the procurement again. But it is unclear where things are going, and that's the problem. And lack of clarity is a problem for producers, it's a problem for people in the country, and while some programs are continuing, some have stopped. The prevention programs are another story, which we'd be happy to talk about, because that is very important. PEPFAR was a prevention, care, and treatment, and in the end, if we don't prevent new infections,
Yes.
this epidemic is going to get out of control again, then all the gains of the past will be lost.
And the prevention also has to do with the transmission, I'm going to just finish this up, with mother to baby. And that, my understanding that that's been in demise.
The life-saving waivers were supposed to include those. We have had difficulty getting them up and started again. And again, mostly because of how the services are provided. Like if an HIV positive woman comes in and can't get tested, we can't even start the process. So if you take HIV testing away, if you take HIV counseling away, if you take away prevention counseling,
Right.
we can't get to the core ARV services. So even where ARVs still exist and can be given out, we may not be able to get to that part of the care continuum because of all the other blockages that we're seeing.
I think I understand what you're saying. Prevention, people are just going to get sicker and sicker unless, and we're talking about millions and millions of people, unless we have some kind of intervention. I hope that somehow we can send a message to, to the administration. We're with trying to become more efficient, accountable, transition to countries being able to, where they can take over these operations, but they have to have something to take over. And just letting millions of people get more sick is just going to make things worse. Thank you for your patience. I yield back.
Absolutely.
I yield
I'm not going to cut off the ranking member.